Hi, ladies and gentlemen. It's Dr. Julio Novoa. Today is February 13th, 2023. Tomorrow's Valentine's Day. So I wanted to make this post related to something that many people enjoy on Valentine's Day, and that's going to be eating chocolate. So what's so important about eating chocolate, or why is it a medical issue? Well, I'm presenting this on a number of fronts, but let's just talk about chocolate in and of itself. Chocolate has some very serious contaminants in it, specifically lead and cadmium. And if you consume dark chocolate, it has almost twice or sometimes three times the amount of contaminants of lead and cadmium that's acceptable on a daily basis. So if you're consuming if you're consuming chocolate, you're actually consuming a contaminant of lead and cadmium. And this can have an overall negative effect, especially in children as they're growing, because these contaminants, or specifically lead, accumulates in the body over time, and it can cause serious problems, growth issues, and permanent damage to organs if their consumption of lead is too high. That's one of the reasons why we stop using lead in gasoline and lead paint, for example. So please keep in mind that the fact that dark chocolate has the most amount of lead and cadmium in it doesn't take away from the fact that regular or milk chocolate, for example, also has these contaminants in it. What's important to understand is that although if you look at it on a daily basis, what is the threshold of contamination that's acceptable? Again, the threshold of contamination that's acceptable, just because you're consuming milk chocolate doesn't mean that you're not consuming a similar amount because you're consuming more milk chocolate. Most people do not like the taste of very deep dark chocolate. It's a very powerful taste. They're more likely to consume milk chocolate, especially the candy bars, for example. But the fact of the matter is, if you're consuming more milk chocolate, you may pass the threshold of having consumed dark chocolate, for example. So you don't take away from anything from saying, oh, I'm just going to have milk chocolate rather than dark chocolate. So it's so important to understand that if you're consuming any type of chocolate, you're actually going to have some degree of lead contamination or cadmium contamination, and this can affect, especially can affect you as an adult, or even your children if they're consuming chocolate overall. And it can have an effect on pregnant women as their fetuses are growing or the babies are growing. So keep that in mind. Now, there is another association that I wanted to present today that has to do with biological implants. So why would I bring up the idea of or a problem related to nickel and biological implants? And this has more to do with Eshore, for example, as a problem. Or if you have any type of biological implant that has nickel in it, Eshore being the best example, and a crossover association with Felshi clips, for example. We know that Eshore is made of a nitinol, which is a combination of nickel and titanium. Felshi clips are said to be pure titanium, but here's the effect. If you consume a product that has a high level of nickel in it, you can induce a biological response to that, which is called the systemic nickel allergy syndrome. And the two most common symptoms of that are going to be an outbreak of a rash or similar skin sensitivity, as well as intestinal symptoms. So you may break out with a rash on your skin or on your face, and you think that you were exposed to some type of cream or something, or some type of environmental exposure. In reality, it was the consumption of nickel. And also you may start to show symptoms of irritable bowel syndrome, Crohn's disease, or ulcerative colitis as a response to the consumption of nickel. And this is most common for example, in the patients that have Eshore. And it's very important to understand that you have to limit the amount of nickel in your diet, and therefore limit the amount of chocolate in your diet if you suffer from problems with Eshore. Now, the crossover to the Felshi clip is this. Although Felshi is made out of titanium, the fact of the matter, if you're going to get a sensitivity response to nickel for Eshore, Eshore also has titanium in it, and therefore you, as a Felshi clip person that has a sensitivity there, you may also start noticing symptoms related to the consumption of nickel. Now, if you have other biological implants, the same applies. If you have breast implants, if you have meshes, vertebral implants, even implants that are made out of pure metal, the problem is this. If you have a biological implant, such as one of these implants, and then you're triggered by the consumption of something in your diet, you may have a systemic response and not be able to explain, well, I was fine yesterday, then I ate chocolate, and now I don't feel well, but I can't put two and two together. That's the two and two together. The idea that the consumption of something that's chocolate, which has nickel in it, which has lead in it, which has cadmium in it, can induce a foreign body reaction that triggers your own sensitivity to the biological implant that you already have. Please keep these things in mind, especially if you do have biological implants. If you don't have biological implants, please keep in mind that the consumption of chocolate during Valentine's Day is not necessarily a good thing and should be done in moderation. I hate to put a downer on the holiday, but I thought it was important to talk about it, especially since I expect, as we all expect, so many people to start consuming a lot more chocolate on Valentine's Day because it's given to us as a gift. Thanks so much for watching. Take care.